Hello all. Welcome to the lecture on the injuries due to cold and heat. I am Dr. Sanil Kumar, working as professor and HOD in the Department of Forensic Medicine, Government Homeopathic Medical College, Kozhikode. First, we'll be looking into the injuries that can occur due to extreme colds. So, exposure to cold produces hypothermia. So especially when the body temperature is below 35 degrees centigrade, we experiences hypothermia. So the body can tolerate dry cold better than wet cold. And infants and old people are more susceptible to cold injury. Also, fat persons and women can tolerate cold better. Another point is that alcohol, starvation, fatigue, disease, etc., decrease the tolerance to cold. So, body can tolerate dry cold better than wet cold. So, and infants and old people are more susceptible to cold injury. Fat persons and women tolerate cold better. And alcohol, starvation, fatigue, and disease decrease the tolerance to cold. So the direct effect of cold are prominent in the tissues like fatty tissue and myelinated nerve fibers, and the indirect effect of cold are mostly ischemic due to vascular damage, which is caused basically by vasoconstriction. And the ability of the hypothalamus to regulate temperature is completely lost below 30 degrees centigrade. Now about the pathogenesis of cold injuries. So, locally, four types of changes can occur like vasospasm, damage to the blood vessels, and increased capillary permeability, blister formation, and formation of ice crystals in our body. So, due to vasospasm, there will be blanching and paleness of skin. And due to and this causes damage to the blood vessels and there occurs increased capillary permeability, so there can be erythema, edema, swelling, and blister formation. And the blister formation will be mostly involving the skin, subcutaneous tissue, muscles, and nerves. And there will be formation of ice crystals, so the area affected will become frozen, stiff, hard, and later it become necrotic by direct effect of cold. Or sometimes necrosis may follow vascular occlusion. There can be thrombosis, obliterating endocarditis, secondary inflammation, and infection of the damaged tissues. So the basically there are four pathologies like vasospasm, damage to the blood vessels, and increased capillary permeability, blister formation, and formation of ice crystals in the affected part. There are three types of local effect of cold, that is frostbite, trench foot, and immersion foot. We will consider trench foot and immersion foot together. So they are it's a condition of the foot which resembles frostbite, but it is caused due to prolonged exposure to cold to temperature like 5 to 8 degrees centigrade plus dampness. So prolonged exposure to cold plus dampness is the root cause for trench foot or immersion foot, and it often affects soldiers in trench, so it is called trench foot. And trench foot is sometimes also called as immersion foot. So, at first, a person with trench foot may also develop a blotchy, cold skin and have a heavy or prickly feeling in his or her foot, or a numb feeling in his or her foot. And typically, the foot also feels dry and painful and becomes red when they are subjected to warmth. Along with trench foot, leg cramps are also a common finding, and the pulse may be slowed or completely stopped in the affected foot. And a person with trench foot may also develop blisters on the foot within 2 to 7 days, and after the foot is excessively soaked. And after forming blisters, the skin and other tissues on the foot die and begin to fall off due to necrosis. And when the trench foot is severe and left untreated, the entire foot can be affected like this. The entire foot can be affected, and we may need amputation to save the uh, leg of the patient. Another condition is called the frostbite. So, frostbite is a medical condition whereby damage is caused to the skin and other tissues due to extreme cold. At or below 15 degrees centigrade or 5 degree Fahrenheit, the blood vessels close to the skin start to narrow, or there occurs vasoconstriction. So the vasoconstriction is actually a defense mechanism by our body to preserve the core body temperature. So a combination of cold temperature and poor blood flow due to vasoconstriction can cause severe tissue injury by freezing the tissue. So the initial stages of frostbite are sometimes called as frost nip. So this is the graphical representation of frostbite. First condition is called the frost nip. The superficial layers of the skin are affected. Then there is a superficial frostbite, then deep frostbite, and later gangrene. So generally, frostbite is accompanied with discoloration of skin along with the burning and tingling sensations, partial or complete numbness, and possibly intense pain. So along with the frostbite, there will be discoloration of the skin, burning or tingling sensations of the affected part, partial or complete numbness, and possibly intense pain. And if the nerves and blood vessels have been severely damaged, gangrene may follow like this, and we have to do an amputation to save the remaining part of the limb. And if the frostbite is left untreated, the skin gradually darkens after a few hours, and the skin is destroyed by frostbite, becomes completely black and looks loose and flayed as if burned. So this is a picture of a soldier who have been amputated due to frostbite. So that were the local effect of cold, trench foot or immersion foot, and frostbite. Then about the general effect of cold. This can be manifested in three stages. So in the first stage, the patient feels cold and he will shiver and the body temperature falls. In the second stage, the shivering will stop when the temperature is at or above 32 degrees centigrade. Below that temperature, the victim will be depressed, and with further cooling, he becomes lethargic, drowsy, and sleepy, which gradually passes into stupor and coma. The muscles will be stiff and the mobility also will be impaired. The respiration, circulation, metabolic, and enzymatic processes slow down or may become blocked. And in the third stage, when the temperature is lowered to 27 degrees centigrade or even less, which if maintained for 24 hours or longer, is fatal to that person. And the cause of death is failure of vital centers due to anoxia. So what is the treatment for hypothermia? Firstly, we have to dry warm with hot water bottles at 40 to 42 degrees centigrade, and immense heat can produce gangrene also. So we have to keep the temperature at 40 to 42 degrees centigrade or 104 to 108 degree Fahrenheit. And we should not pick the blisters, and use of anticoagulants and antibiotics may be required to prevent to provide antibiotic cover to prevent infections, and death may occur due to failure of vital centers due to anoxia or ventricular fibrillation and cardiac standstill. So we have to dry warm the patient with hot water bottles with the water temperature of 104 to 108 degree Fahrenheit, and soak the injured area until it flushes pink, and keep the water fresh and warm, and keep the injured area away from sides and bottom of the tub. These are the precautions to be taken while dry warming the patient with hot water bottles. So what would be the postmortem findings of a death that occur due to hypothermia? Externally, the skin may be pale, blisters are usually present, and there can be gangrene of exposed part. Generalized edema also may be seen. Rigor mortis may appear slowly, and if Postmortem lividity develops, it will be of dark red color. The internal findings in subcutaneous tissue, it would be relatively avascular. There can be ice crystals in blood vessels, heart, and tissue spaces. Usually, the blood will be bright red. In the heart, both the chambers will be full. Right chamber as well as left chamber will be full. And in the brain and abdominal viscera, the parts will be congested and hemorrhagic. There can be fat necrosis of pancreas also. The medical legal aspects of hypothermia, usually the death are accidental, and it is commonly seen in mountaineering people, and exposing the infant insane, aged, or sick to cold may be considered as homicidal. Uh, Newborn or infants are more prone to cold injury because the surface area is more, and heat regulation center is poorly developed, and they can't produce heat by physical means, exercise, shivering, etc., and also heat production by chemical processes are also poor. So these are the reasons why newborns are more prone to cold injury. Artificial hypothermia of temperature 21 to 25 degrees centigrade may be induced during operation on brain, heart, kidney, etc., for a bloodless surgery. Cold storage of dead body in freezers in temperature 4 to 8 degrees centigrade retards decomposition. So these are the medical legal aspects of hypothermia. Another peculiar type of hypothermia is there, like reciprocal or paradoxical undressing. This is actually accidental hypoxia in which it occurs in old persons, and the cause of condition is not known, but it may be due to long exposure to severe cold producing paralysis of the thermoregulatory mechanism. And due to the paralysis of thermoregulatory mechanism, there occurs failure of vasoconstriction of arterioles of the skin, which results in a flow of blood from the core of the body, thus giving the person an exaggerated sensation of warmth. So due to this exaggerated sensation of warmth, or the patient may take off some of their clothings due to great discomfort, and death may occur if the body temperature falls. So this is a rare condition, the strange condition seen in accidental hypothermia, particularly occurring in old people. The main cause is due to paralysis of thermoregulatory mechanism. Now coming to the heat injuries. So there are three types of injuries that can occur due to heat, or the general effects of heat. First one is heat cramps or miner's cramps or stalker's cramps or fireman's cramps. Second is heat hyperpyrexia or heat stroke, or otherwise known as sunstroke. Third one is heat prostration, heat exhaustion, heat syncope, or heat collapse. So you look into one by one. So heat cramps or miner's cramps, stalker's cramps, or otherwise known as fireman's cramps, is seen in workers who are working in high temperature and the sweating is profuse. So due to sweating, the result is dehydration due to loss of water and loss of sweat. So the body will be highly dehydrated, and this gets precipitated by drinking unsalted water. And there occurs severe cramps of muscles of limbs and abdomen. You can see these kinds of heat cramps occurring in athletic championship in our school sports. So we are not accustomed to high temperature, and due to sweating we lose a lot of water and electrolytes. So many of the non acclimatized people will experience severe cramps in the muscles of limbs and abdomen. So if we see a patient suffering from heat cramps, the face will be flushed, the pupils will be dilated, there will be dizziness, tinnitus, headache, and vomiting. So what is the treatment for high heat cramps? So we have to elevate the feet and use a fan to lower the temperature of the patient. We have to apply cold compresses, and we have to lie down the patient, keeping the foot elevated and give plenty of food. So if we can hospitalize the patient, we have to give IV saline or sodium chloride in water every hour. And if the patient is suffering from cramps, we have to give him sedatives to relieve the pain from cramps. Next condition is heat prostration or heat exhaustion, otherwise known as heat syncope or heat collapse. The reason for heat prostration is exposure to high temperature in a closed environment. And usually heat prostration is precipitated by muscular exercise and unsuitable clothing. And this is due to the loss of fluid and sodium in sweating. So in hard laborers, an estimated 3 to 4 liter of fluid loss occur per hour. So if we do not rehydrate the person, heat prostration may occur. Extreme exhaustion and peripheral circulatory failure result in collapse of the patient, and the usual presentation is like this. The face will be pale, the skin will be cold, pupils are dilated, thready pulse and sighing respiration, and death may occur due to cardiac failure. Treatment is giving plenty of rest, and we have to give intravenous injection of glucose, and the chances of recovery are also very good if treated properly. And purely all these cases of heat prostration or heat exhaustion, heat syncope, heat collapse, etc., are purely accidental. Next is the most grave condition, that is heat hyperpyrexia or heat stroke, or otherwise known as sunstroke. So heat hyperpyrexia occurs in the temperatures above 41.5 degrees centigrade, and heat pyrexia is due to the decreased function of heat regulating mechanism, and heat stroke is due to the failure of heat regulating mechanism. So heat hyperpyrexia is due to decreased function of heat regulating mechanism, and heat stroke is due to the failure of heat regulating mechanism. So these occur due to exposure to heat in open, and humidity increases the effect of heat. So we'll try to differentiate between heat exhaustion and heat stroke. I've earlier told that heat hyperpyrexia means it is due to decreased function of heat regulating mechanism, and heat stroke is due to failure of failure of heat regulating mechanism. So in heat exhaustion, there is moist and clammy skin, whereas in heat stroke, there is dry and hot skin. In heat exhaustion, the pupils will be dilated, and in heat stroke, the pupils are constricted. And in heat exhaustion, there is normal or subnormal body temperature. In heat stroke, there will be very high body temperature. The predisposing factors for heat hyperpyrexia or heat stroke are high temperature, increased humidity, minor infections, muscular activity, and lack of acclimatization. So these are the principal factors for heat hyperpyrexia: high temperature, increased humidity, minor infections, muscular activity, and lack of acclimatization. Other factors are also there, like old age, any pre-existing illness, alcoholism, use of major tranquilizers, obesity, lack of air movement, and unsuitable clothing. So, failure of cutaneous blood flow and sweating, the factors which control body temperature, leads to a breakdown of the heat regulating center of the hypothalamus. So the reason for breakdown of heat regulating center of hypothalamus is the failure of cutaneous blood flow and sweating. So these two factors, like failure of or cutaneous blood flow and sweating, are the factors which control body temperature. So these two factors will fail, and this will lead to breakdown of the heat regulating center of hypothalamus, and sunstroke results. There are two types of sunstroke, that is the exertional heat stroke occurring in athletes, military personnel, or other persons working hard in a hot environment. And the second type is in old persons, usually over 60 years during heat waves. And in the classic form of heat stroke, sweating will be absent. There will be dry, clammy skin. The manifestations of heat stroke include sudden collapse and loss of consciousness. There can be headache, nausea, vomiting, weakness, dizziness, staggering, mental confusions, and cramps. The body temperature, if measured, will show a temperature of about 40 to 46 degrees centigrade. The skin will be dry, hot, flushed, and there will be no sweating. Also, the pupils are dilated, pulse rapid and irregular, respiration will be increased, blood pressure will be low, urine output is decreased, CNS disturbance like psychosis, delirium, convulsions, and coma may present. And usually, death results due to coma and asphyxia, and death usually results in 5 minutes to 3 days. Treatment for sunstroke, we have to remove the clothes and put in cold water tub of temperature 37 to 38 degrees centigrade, and later he should be wrapped in wet sheets. IV drip with noradrenaline, corticosteroids, etc., and artificial respirations are the treatment of choice. Postmortem findings of heat stroke. We'll get postmortem caloricity. In the CNS, the brain will be congested and edematous. Petechial hemorrhages may occur in white matter. Cerebral hemispheres increase in weight. Flattening of convolutions of brain also occur. In the respiratory system, there is hemorrhagic frothy fluid in trachea and bronchi. Lungs may show edema, congestion, and hemorrhages. Heart shows dilatation of right auricle, flabbiness of muscle, petechial or confluent subepicardial and subendocardial hemorrhages, and degeneration of myocardia. So all three vital areas like central nervous system, respiratory system, and heart shows typical postmortem findings. And in the liver, there is congestion and centrilobular necrosis. In the kidneys, there is congestion, edema, and increase of weight. In longer survival cases, tubular necrosis and hemoglobinuric nephrosis is commonly seen. In adrenals, there is pericapsular hemorrhages, enlargement of sinusoids, and cortical degeneration occurs. The general effects, general postmortem findings like petechial and confluent hemorrhages and disseminated intravascular coagulation may be seen in most organs. These are the postmortem findings of heat stroke. So we are coming to the end of this session. The topics discussed today was a general effect of cold, or otherwise known as hypothermia, local effect of cold like frostbite, trench foot, or immersion foot. Then the general effect of heat like heat cramps, heat prostration, heat hyperpyrexia, or heat stroke. In the next lecture, we will discuss about the local effect of heat like there are two conditions called burns and scalds. Thank you.